Good day, everyone. So, welcome to our module, your basic life support. So, actually, your emergency management module is divided into two. We have the emergency management one, which concerns with your basic life support, and your emergency management two, which concerned with your standard first aid. Okay, so we will be having the discussion via this video, and then all the demos and the return demonstrations will be done in actual basis, and of course in a guarded, monitored, and what do you call this one, monitored, guarded, and of course supervised. Okay, so good morning to all people out there, for good afternoon for some. And we will be starting now your basic life support module. So in your emergency management, the grade of this is separate with your emergency management too. So we have 60% would be from your skills, or either 60 or 50 to 60% if the performance with your exam is low, so that is why we're going to have 60%. But if it is okay, so we're going to have 50%. Okay, so we're going to start the discussion proper. Why is it necessary for you to study this one? So that, of course, you are caregivers, future caregivers. So you're going to deal with people, and as much as possible, you're going to be of help to a individual, to somebody or to an individual. So actually, we're going to start first with our discussion with your first aid. So it is concerned now with your BLS, but generally speaking, it is termed as your first aid. So first aid is an immediate care given to a person who has been injured or suddenly taken ill. So I leave the important things in a blank form so that you could follow by writing them in your handouts. So it is either self-help or home care if medical assistance is not available or delayed. Okay, so for example, if you have seen somebody who fainted, so basically you're going to do some, or to give some first aid. So we're going to study that aspect. Okay, so we have role and responsibilities of a first aider. One is blank or bridge that fills the gap between the victim and the physician. So it is necessary for you to perform first aid because the physician or the higher ups or the other medical profession are what we call this one, are not on the site or on the scene, diba? So they will just arrive after you have done giving your first aid, or during or while you are giving your first aid. That is why to have an immediate response to that situation, you're going to bridge the gap, o diba, between the victim and of course the physician. Number two is it is not intended to compete with or to take the place of the services of the physician. So, you as a caregiver is not intended to compete, di ba? Hindi pwede na, okay lang walang physician kasi may caregiver naman. No. So, we need also the proper diagnosis of the physician as to what happened to that person and what is the reason behind the person nga nag-faint siya. Next, number three is it ends when the services of the physician begins. Okay. Automatic ha. It ends when the services of the physician begins. So, dapat wala, pag dumating na yung physician, you have to turn over the client or the patient to the physician. So, dili kay hingabot ng physician and then you did not give the physician a way to examine the patient. Dapat you should not you should not, what we call this one, you were going to offer the patient to the physician so that he could do his intervention. Di pwede na, ay ayaw na lang, ako na, ni kaya rin na ako. No, ha. So, objectives of first aid, one is to alleviate One is to alleviate suffering. Okay. For example, in cases of your vehicular accident, di ba? So, in cases of fracture or bleeding or trauma made during an accident. So, to alleviate suffering, so you're going to perform first aid. Number two is to prevent added or further injury or danger. Okay, so you're going to do some splinting. So as what I've said, generally, how we will not only cater your your BLS this time, but of course you're going to cater general, either your standard first aid and your BLS. So we have there is to prevent added or further injury or danger. That's why you have to place a splint. And next is number 3 is we have there to prolong life. Okay, to prolong life. So, dapat you're going to do first aid so that you could prolong the life of the patient, diba? And preventing it from getting injured. Okay. Next slide is we have there your guidelines in giving emergency care. So we have getting started. You will never see the emergencies you prevent, di ba? We cannot foresee emergencies. We cannot foresee what will happen. So that is why it is said that you will never see the emergencies you prevent. Okay. However, emergencies can and do happen regardless of attempts to prevent them. Of course, di ba? Bisang pagsige kagamping, but as what I've said, accident will come all of the sudden. Dili siya mananghid. Preparing for an emergency, the blank there is emergency, would benefit the provider in giving appropriate care to a victim. Okay. Preparing for an emergency would benefit, of course, the provider to give appropriate care to the victim. The following are guides to assume the provider to respond to an emergency properly. A is you have to plan of action. So, dili lang hara-hara ka nga for example, um, naligsan, muduolin ka dayon, wala ka ba napaysa ka, bus nagpadulong, ikaw maligsan, di ba? You have to plan your action. Or, for example, the hallway is very narrow. So, you will just enter inside and makakabalungan na aday dito ang kalayo, di ba? In case of fire, sa pag-abot mo dito, narrow kayong kanang agianan, and pagsulod di mo, na-block ang imong giagian. So, ikaw nasunog ug una, wala ang client. So, you have to plan your action. And next, gathering of needed materials. So, dapat nakagather na ang needed materials, ha? Just for example, kung kabalo ko kung ngit-ngits, you have to you give flashlight, di ba? And of course, if you're going to have a fire, so dapat na kayo mga appropriate equipment, di ba? So, just like for example, rope and all. And then we have initial response. So, this is initial response. What would be your initial response? We have letter A, ask for help. So, do not go to the war without your soldiers, diba? You should have a company. Dili pwede nga maadto lang ka, ikaw lang isa. So, remember na, much better if you are going to do the rescue with the presence of other people. Just like, for example, in giving CPR, if you're going to give CPR, you have to pay attention also with the fact that the patient, that there will be a bystanders watching you nga naman. Because if somebody, kung ikaw lang isa, tapos you perform CPR, then when other people were going to arrive, you will be accused that you killed the person. So dapat naa kay witness. Number one, letter I is in your aid is intervene. Okay, so after you mo mag-ask for help, so you do your intervention. For example, if it is negative pulse, negative breathing, so you give cardiopulmonary resuscitation. If positive pulse, negative breathing, so you give now your artificial respiration. Letter D, do not further harm the client. Okay. And last letter is instruct the helpers. If you have helpers or by the bystander, you have to instruct them as to what to do. Just for example, also in carrying heavy patient, di ba? So you have to ask for the second body or the second caregiver for you to lift the client, di ba? So, dapat there should be what we call this one, coordination. Okay, that is why you have to instruct helpers. Okay, next slide, please. We have there your emergency action principles are the principles that ensure your safety and that of the bystanders. So, One is, how would you ensure your safety? You have to survey the scene. Okay, survey the scene. So, how would you do that? Is the scene safe? So, dapat lang tawon mo siya kung safe ba ang scene, ha? Maaba siya somebody murag, actually, you have your instinct. You would know if your safety would be in danger. So survey the scene. Is the scene safe? Oh, if yes, do you have to what happened? Or hey sir, are you okay? O diba? So next is what happened? So if there is fire, if there is if somebody is drowning, or somebody is fainting, or somebody just lost his consciousness, or somebody fell from the um 20th floor, giduko ning ambak, suicidal siya. So what happened? And then let us see how many people are injured, di ba? Pila ka buk ang injured, di ka naman. You were going to do prioritization. Prioritization, kung daghang kayo, 6 ka buk na injured. So you have to do prioritization. How? Katong pinaka grabe, so you would refer it to your ABC. Airway, breathing, and your circulation. Mostly, ang banha nga client mo na dugay, i-intervene nga naman. Because banha ang client, of course, the client is breathing. There's no problem. Because if not, kung nagutong-utong siya, meaning the client is in pain. And are there bystanders who can help you? Kung naa, so check. So check nimo. And next is, we have also, then identify yourself as a trained first aider. So, as what I've said, survey the scene. Lantawa. Then the scene is safe. Then, pangutanaw what happened on sa day. Then, pila ka tao na injured. And of course, try to look for bystanders who could help you. And then identify yourself. Okay. So, I am Irene Lim, trained first aider. I can help, diba? So, I can help. Number 1 is do a primary survey. So, this time is, unsa man ka? Check the head for any wounds or bruises. Check the eyes for abnormal constriction or dilation. Check the nose for blood or fluid drainage. The ears, of course, for blood and fluid drainage still. And another is the neck, and if possible, the whole body for injury or fracture. Then declare there is no injury or fracture. So we have, before that, you have to check the mouth for obstruction. If there's no obstruction, so yun ka, walay obstruction. Okay, then ay pa ka ma-proceed with the check the neck and if possible the whole body and for injury or fracture. And then of course, after that, check pulse and breathing. To check pulse and breathing. So, with checking your breathing, you are, di ba? You're going to count the number of breaths. And during the primary survey, you should have checked the airway na. How? By for checking if there is no obstruction. Kung nakasulod ang hangin nga imong giblow, so there is no obstruction, so the airway is fine. And if the airway is fine, you're going to proceed with the breathing. Manang check pulse and breathing, di ba? And breathing and your circulation. So it should be done along the way or simultaneously. And two ways to open the airway in your checking the airway. One is head tilt, chin lift maneuver. For the patient who have not sustained trauma, this simple maneuver is sometimes all that is needed for the patient to resume breathing. How would you going to do this? Head tilt. I-tilt mo ang head and then i-lift ang chin and then of course, head tilt, chin lift. Pwede ka naka sa back of the head of the patient, then mo i-tilt lang ang head niya gamay, i-open mo ang, lift mo ang chin to open the airway. And in letter B, we have your jaw thrust maneuver. If you suspect a cervical spine injury, use the jaw thrust maneuver. It is a technique to open the airway by placing the fingers behind the angle of the jaw and lifting the jaw upward. You can easily seal a mask around the mouth while doing the jaw thrust maneuver. Again, aha ka mo posisyon, pwede po adto ka sa back sa iyang head and while the patient is lying. And then, of course, you're going to do jaw thrust maneuver. Letter B is your check for breathing. Check for breathing ta. So, check for breathing. So, we have there your characteristics of your respirations. One is normal. Okay, the first one is normal. Normal when breathing is neither shallow, dili mabaw, dili pud lalom, nor deep. Average chest wall motion. Pag mag-breathe ka, normally dili kayo maklaro ang pag-rise and fall sa imong chest. And then, no use of accessory muscles. What do you mean by accessory muscles? Kanang imong shoulder, di ba? You have muscles there that you are going to rise and fall. Just like, okay, that is your, what you call this one, abnormal na siya. So, normal kung dili gamitan og accessory muscles for breathing and average chest wall motion. So, the breathing now is neither shallow nor deep. Okay, next is shallow. Slight chest or abdominal wall motion. Okay, slight chest or abdominal wall motion. So, shallow siya. Nagsaka-saka lang iyang abaga pero gamay ra. Then, next is to your shallow, we have labored or stertorous breathing. Okay, labored, naglisod na. Mura naglaborer, labored, or naglisod, di ba? Para hindi malimot. Naglisod o ginhawa. So, there is increased breathing effort. So, ano na? Di ba? Effort kayo pag that is your labored breathing. So, there is increased breathing effort and then there is grunting and stridor. Then, use of accessory muscles. Asa mga accessory muscles, diba? So, your imo ang sa imo shoulder plus of course sa imo ang chest. And possible gasping. Okay, what do you mean by gasping? So, ang paginawa is dali sure dagdali gasping. And we have next is nasal flaring or ang ilong is nagginga ginga na siya. Okay, naginga-ginga. Oh, nasal flaring. And supraclavicular and intercostal retractions in infants and children. That is now your labored breathing. Okay, makita na ang ilang mga, kung sa kuan pa, ang kwirdas nakita na pag ginhawa niya. Or ang iyang rib nga mga ang iyang rib nga muscle nga nag-attach visible na. Okay. And of course, we have next is your noisy. Noisy when there is increase in sound of breathing including snoring, hagok, or wheezing or taghoy, gargling, and then crowing. Gargling, migo, imong mag-gargling ka, mura ka na bitang maghago ka nga, ana, that's your gargling. Kanang, ana. Wheezing is, while you're crowing, wheezing, at the end of wheezes, that is your crowing. Okay. So, next to that is your checking for letter C. Okay, ABC ha, airway, breathing, and circulation. So, letter C is the victim's heart beating. So, that's why you have to check for pulse and breathing. So, how? Of course, you're going to hold the brachial pulse if it is an infant and check for the carotid pulse or hold the carotid pulse if it is an adult or a child. Okay, again, check circulation by checking holding the brachial pulse if it is infants. If it is now an adult or a young child, so you have to hold locate the carotid pulse, diba? And so that is how, and you have to assess the pulse. And another also is if the patient is bleeding or not. Okay, so that is how to check for your letter C. Okay, and next to that, after checking ABC, the next thing to do is to activate medical assistance, or you have to transfer the client to the facility. So, how to activate medical assistance? You have to call for 911 or ano si tawag diri sa tuwa? 111? I forgot. I don't know. Nalimot ko. 110 or 1001. I forgot. Okay, but generally the statement is 911. Okay. You try to research what is the hotline, emergency hotline in Ozami City. Okay, and then of course, when you're going to call, you have to state what happened, then the location, number of persons injured, extent of injury, and the first aid given. Kung nagabay na injured, tapos imo nang tagag first aid, and nagka-gain ng consciousness, pero kinahalalag monitoring. And of course, the telephone number from where you are calling. And the person who activated medical assistance must identify him or her and drop the phone last. Okay, how would you think to do it? So, mingon din ka nga activate medical assistance. Hey, hello sir, I'm Irene Lim. State your name. I'm here at second floor, the Guzman Building, La Purísima Street, Ozami City. Okay, that is the location. And then I have a client. Okay, the situation. What happened? I have a client lying on the floor. Okay, ang client so isa. But because I have clients here being trapped under. So that is your pila ka book. I have 6 clients, diba? Or kung isa lang, I have client running in the lying on the floor. And then what happened? You have to tell unconscious or kung conscious. And then first aid was given 3 minutes ago. O, diba? Dayon, Then, of course, if the client need much more emergency, and then you're going to tell the client then, ang tawag ini, first aid is given 3 minutes ago, but client is need for monitoring. And then, of course, being waiting for your assistance, you have to tell your client the opposite line, kung kinsa ka, and then, of course, you have to drop the phone last. And then additional, you have to state your telephone number. Anyway, cellphone ang gamit karon, pwede na siya lang tao kung unsa nga number ang nanawag. Okay. So, do a secondary survey of the victim by interview the victim. Ask for the following questions. Introduce yourself. Okay, so how are you going to, I'm Aaron Lim, then ask the victim's name. And then you are, may ka nga siya nga, may po siya nga, si kuan ko, si Tarpulana kurung-kurung. So, if Tarpulana kurung-kurung, okay. Tarpulana kurung-kurung, naon sa ka. That is what happened. And get permission now to give care. Paglandaw mo na samad siya. So, may yun ka nga, okay, ato siyang i-bandage. Okay. So, ako siya, i-dressing ang imong samad. Okay. Or, can you breathe? Kung malisod siya ginawa, can you breathe? So, may siya nga, gulat siya siyang liog? No. So, magligo-lingo siya. Di siya miyog, no. Pero maglingo-lingo siya siyang ulo. Meaning, the client has this possible of your choking. Okay. And then, kung mayroon siya, for example, mayroon siya nga, my head hurts. So, pag may head hurts, naunsa ka? Do you have medicine on your pocket? So, that's why mo siyang kapkapan sa iyang pocket kung naaba siya para sa atambal for the emergency. Nga, unsa man siya. Usually, mga known hypertensive clients, they have that on their pockets or in their bags, diba? Or known asthmatic clients, they have the puff on their bags or pockets. And then check the vital signs. Determine the radial or the carotid pulse. So next is determine the skin. Kung baby ha, ang baby is, you have to check the brachial pulse. So, determine the skin appearance. Look at the victim's face, kung lagom, or dili. Kay kung lagom, meaning poor oxygen. And then the lips, also, pag lagom, poor oxygen. Record now your skin appearance, including the temperature and moisture, and of course, the color of the skin. So, determine the breathing. So, kung dapat naka-breathe siya, ha? I-count nimo for 1 minute. Dapat 20 cycles per minute in our vital signs, or 20 breaths per minute. In some book, 12 to 20. In some book, 16 to 20 breaths per minute. And letter C, head-to-toe examination. The head, look and feel for cuts or bruises, diba? So, check for cuts or bruises, and then after that, you visualize the hands if there is no blood or bleeding, so there is no cut or your bruises. And then the eyes, check and compare pupils. Dilated pupils. Pag dilated ang pupils sa client, sorry ha, nawala ang akong kaning chuchu, kaning red. Dilated pupil gani, so meaning that is sign of bleeding or shock. So, you have to intervene that one. So, next is constricted pupils. So, there is a sign of heat stroke or drug overdose. So, dali na kayo mag-doctor, no? Doctor, I am sick. And unequal pupils, meaning head injury or your stroke. So, naman, kung constricted yung pupil, so, you going to, most probably, na-heat stroke siya. So, what happened to the vital signs here? Increase ang blood pressure. Together also with your, with the rest, diba? The bleeding, and of course, we have your head injury. Especially if we're going to refer to a elderly client. Okay, so remember ha, dilated pupils, constricted pupils, and equal pupils goes along with increased blood pressure, especially if the client is elderly. Okay. Then we have the nose and ear and your mouth for fluid or blood drainage. Kung naining agas nga fluid, gikan sa dalunggan or sa iyang ilong, or even sa mouth. Kung mouth, naay blood nga mugawas, gikan sa mouth, you have to stop giving ventilation or giving what we call this one, ventilation or your respiration. Okay. Or 2 blows or 1 blow or mouth to mouth. Okay. Bawal siya because of the blood coming out from the mouth. And then the neck. Oh, you have to feel for injury. Or you ask the patient kung naabay injury. Okay. Or how? By if makamove siya. So, meaning makalingi ka. Kung dili, so there is neck injury. Sakit? Okay. Sabihin mo siya sakit, so there is a injury. Collarbone, you have to check and compare the shoulders. Kung collapse ang isa, possible fracture, di ba? Collarbone ha, hamang collarbone mo, kani, same ang shoulders. So you have kung collapse ang isa, so fracture. Chest and ribs, check and compare your chest, okay? Abdomen, check for tenderness. Press the abdomen using flat fingers. Okay, nga naman kung tender ang abdomen, what will happen? So we're going to deal that one after. Hip bone, press slowly inward and upward, usually for pain. Leg, one at a time, erase your, can you erase your leg? Okay, erase. Pikas ang right na pod, erase. And then the arm, so the same, erase gihapon. Erase or ialsa. Or kaliko kasi mong fingers, ipalihok-lihok ang mga fingers. And spinal column, press gently from cervical region down the lumbar. Usually, hindi na siya nang ginahimo ang spinal column. Okay, as long as you could, pangutanon nimo, are you in pain? Sakit? Inig-move nimo? Pag may sakit, do not ever dare to carry or lift the patient. Okay, possible fracture siya. On record all assessments and your time. Kung sa mo nag-observe gikan sa first nato nga gi-discuss katong atong head to toe assessment. So examination, I mean. So you have to record it. Okay, i-record nimo siya. Next na pod, we will have the step 1, during the head to toe, inspect the entire body starting with the head. So, we're going to demonstrate this one to you. To check the neck, look and feel for any abnormalities. The victim has no pain. Have the victim turns his head gently from side to side. So, this is applied during your head to toe assessment. So next, step 3, we have checked the shoulders by looking and feeling for deformity. Ask the victim to shrug his shoulder. So lihok kayo ng shoulder. Pag dili malihok, meaning fracture. And step 4, check the chest by feeling the ribs for deformity again. And ask the victim to take a deep breath and exhale. Okay. Okay, if dash pain nga ma-feel during exhalation, so meaning it is still fracture. Apply slight pressure to the abdomen. So, to see if it is soft and rigid. Just like in the picture. Okay. Pag nasakit, either naay na, unsa man siya, na-injure nga vital organ inside. And check the arms by feeling for any deformity. If there is no apparent sign of injury, ask the victim to bend or lift the arms and move the hands and fingers. So, di ba? Dali ra kay siya. Pwede ito ma-doctor actually, char. No, dili. Next is step 7, to check the hips. How? Ibutang sa kilid ang imo ang kamot, hips, kilid sa hips sa client. So, place your hands on both sides of the pelvis and push down and in, asking the victim if he or she feels any pain. Then step 8, we have check the legs by feeling for any deformity. If there is no apparent sign of injury, ask the victim to bend the legs or lift the legs and move and fit, and plus of course the toes. Okay. And then the step 9, the last step, we have gently reach under the victim to check the back. Okay. So usually, di na siya gina-check, dala na, ano siya, kung wala, if you're not in pain, so we're going to rush you to the hospital, ibutan siya sa stretcher, especially kung di siya katindog. So, now, we're going to proceed with the golden rules of emergency management. One is what to do and what not to do as number 2. One is you have to obtain consent whether possible. Okay. Pag mag-imong hilabta ng patient, mingon gyud kang akong hikaman ang imong tiyan ha. Okay. Or kuan ti kang blood pressure ha, akong i-loosen up ang imong sanina. O ang imo ang polo o imo ang tangin sleeve. Okay. And think for the worst. Dili kay yes, it's true. When you're going to see a client lying on the floor, you have to think for the worst. Dili kay, lantaw na mo, murang hangad-hangaran, oh, okay rin na siya. Murag wala ra. No. You have to think for the worst. Meaning, you have to prepare yourself. Kano, if you're not going to think for the worst, you will just suddenly lift the patient up. No. Kundili, imo na nga, this is possible fracture or this is possible injury depending upon your assessment. And then call or send for help. Okay, you cannot do it alone. And identify yourself to the victim, as what I've said ganina, and provide comfort and emotional support. Okay, especially maghilak ang patient, dapat ayaw hilak. Wala makatabang nimo, ikaw ra. Naami para mo assist. And then of course respect victims' modesty and physical privacy. So modesty, you have to you have to ensure privacy. Or do not overexpose the client, or again, expose only the part that needs examination. And then we have also care for the most serious injury first. Yes, especially pag lima sila kabuok, imo sang i-assess. Kung kaysa itong gahilak, mostly, ayaw sa to i-assess. Nga naman, you have to check the airway, breathing, and then circulation. In the book, we have also the circulation, breathing, and then the airway. Na, baliktad na siya karon. Unahon pa nimo kung kaysa itong bleeding, mao to imong tabangon og una. Because he has the danger of having shock. Pero, so manang CBA, check for the circulation, and then the breathing, and then the airway. Per case-to-case basis ha, kaya kung let's say nag-grasp na siya sa iyang neck, so you have to check the airway first. Nga naman, there is obstruction already. But if there's no obstruction, granting there's no obstruction, so you have to do the CBA, circulation, breathing, and then of course the airway. And we have also care for the most serious injury first, and assist the victim with his or her prescribed medications. Keep onlookers away from the injured person, of course. And then handle the victim to a minimum and loosen all the tight clothing. So that is what is necessary things to be done. Next is what not to do. Unsa man siya, do not harm the client, do not let the victim see or his injury, kay makuyapan siya makita siyang kamot nga nagtapad na niya, separate na. And do not leave the victim except if you have called for help. And do not assume that the victim's obvious injuries are the only ones. Nga naman, mingkag ay kaniri ang kamot ang nagdugo. No, na pa sa likod nalata, di ba? And do not also deny a victim's physical or emotional coping limitations. So, do not deny. Mayroon ka nga, saba dira. Pag mahila ka, saba dira, ay pag tabi-tabi, di ba? So, for example, mga anak, Pag mga anak, you should in-intervening, mana ka nga, ay, gilak-hilak biya ka nga, baka nagdanawag ani paghimo nimo. No, you should not do that. Do not make unrealistic promises. For example, miyang kag, after ani, mauli anak ka. No, dili. So, unsahan man naman siya. We were going to intervene, and then after that, we will check your vital signs, and we will, tag ini, transfer you to a medical facility. Okay. Dili yun nga, okay na. No. Dili. Do not trust the judgment of confused victim. Sa confused victim, those mga mentally ill, kanang mga gipang sedate nga client, kay under the ini, what do you mean? Under the influence of drugs, those are confused. So, sedate nga client, kay mag-undergo operation. And depressed clients, those are also confused, aside from those diagnosed, the mentally ill. Do not let the victim to make his or her own decision. So, those are the things that you should not do. Okay. Characteristic of a good first aider, number one. Ta-da! Number one, should not cause pain. So, what do you mean by should not cause pain? You have to be gentle. Okay, gentle ha? Gentle, gentle. Then number two, should make the best use of things at hand. So that is your resourceful. You have to be resourceful. And number three, we have one, should notice all signs of on sabadira. So that's your observant. Okay, you have to be observant. And number four, should not alarm the victim. So what do you should not alarm the victim? You have to be tactful. Dili kay halaka ning sirit ang dugo. Makuratan ng pasyente, kanang makuyapan siya. Just like when I delivered my baby, normally dili ko mag-deliver ato through CS, kaya ang sabot naman sa doctor is normal lang. Unya kay nag-premature man siya, ingon din ang doktor, nakakadungog ko nga ang gunting, nagpiti-piti na sa sulod sa ako sulod sa ako ang vaginal opening. O ingon siya nga, ingan ang doktor nga, gahi man rin, syempre, ang akong utok ning dagan na sa, hasya ning dagan, hingatog, oro kaya tayong lahos of Dipolog City, kay, nakulbaan siya, kay unahunan niya nga, unahunan biya, nako nga naigo ang ulo sa kong anak. Muna, you should not alarm the victim, so, you have to be tactful. And then next, number 5, you have to be comforting what do you mean by being comforting? You have to put yourself to your patient's shoes. That is your empathetic, okay, or empathy, diba? And then the last one is you have to be respectable. Nga naman, should maintain a professional and caring attitude. So you have to be respectable. Mo galing nga, dapat kay kamo mga caregivers, you should tie your hair up. Dili kay magpadunghay lang, abi kay bagong rebond. Hampakon. Sige. Manang requirement ha, itie ang imong hair. The next slide nato, we have there your hindrance in giving first aid. 1. What is the number 1? Unfavorable conditions. Nga naman, or surroundings. 1 is unfavorable conditions or surroundings. Unsa man siya? We have nighttime. Lisod kaayo ihatag og rescue kung nighttime. Kay lisod kag assess sa color sa pasyente. Maglisod ka og lantaw kung nag-breathe ba siya wala. Hikam-hikamon na nimo. No, dili. So that is why it is considered unfavorable. Crowded cities such as city streets, churches, and shopping malls. Nga naman, daghang kang tawo. Daghang mo react. Then pag mo react sila, di na ka makasabot kung unsay mo nahon og butang. Oh, way ang butang himo. Di na ka makasabot kung unsay unaon nimo unahog himo, di ba? Kay bana kayo daghang kayong doktor. Di pa imong alsam hala patay. Daghan makuyawan na lang kamo tingkod, lingkod na lang ka sa daplin. Lantaw naman pasyente buhi pa kaday kay because of that crowded city, streets, churches, and shopping malls. And busy highways. That is also one. Kay nganong maglisod ka og diretsos padulong sa aha ka maglisod kag transport sa patient because the street is very much busy. And we have cold and rainy weather. Nga naman, of course, accident, di ba? Maglisod ka. And then we have also your kanang di mo makita, di mo maklaro kay because of the rain. And lack of necessary materials or helpers. Or ikaw ra isa, bas grabe ka lisod. And next, we have also your presence, number 2, presence of crowds. Okay, presence of crowds. Parehara rin sa crowded city or streets. So, crowds, curiously, di ay, watch, sometimes heckle kanang makialam. Sometimes offer incorrect advice. So, as what I've said, malibog ka. They may demand haste in transportation or attempt other improper procedures. A good examination is difficult while a crowd looks on. O, maglisod ka kay daghan kay mo puna, daghan kayong maghimong doktor, magbuot. Unsay imong buhaton. May pa siya pag, ayaw, alsa. Sus, ginoo ko. Diba? So, you have, in that way, you have to listen to your instinct. Okay. Number 3, Number 3, we have pressure from victims or relatives. Okay. So, pressure from pagdali. Oh, gatang ara ka. Sige, yung dali ikaw gatindog ra. So, the victim usually welcomes help, but if he is drunk, he is often hard to examine and handle, and is often misleading in his response. So, mo nang ma-pressure pud ka. The hysteria of relatives or magsyagit-syagit ng relatives or the victim, the evidence of pain, blood, and possible early death exert great pressure on the first aider. Okay. And the first aider may fail to examine carefully and may be persuaded to do what he would know in calm moments to be wrong. Okay. So, dapat dili ka ma-pressure sa victims or relatives. Okay. So, we are going to short, not short, we're going to have short discussion on the transmission of disease. If we're going to discuss this one in our module, your basic infection. So how disease are transmitted? So this is through direct contact, occurs when a person touches an infected person's body fluids that presents the greatest risk of infection for the first aid provider. At present, you have to erase na the at present na libot ko. Wala na ako siya na-erase. So, ang pag-delete ani, wala na delete, ha? Delete na lang. So this is either infected person's body fluids and that presents the greatest risk of infection for the first aid. So, this is your direct contact. Unsa man ni siya nga mga sakit, we have one. Unsa nga mga sakit ang direct contact? We have here comparison of transmittable diseases. We have here your herpes. Diba? Herpes is a viral infection that causes eruption of the skin and mucous membrane. So, mode of transmission niya is direct contact or contact with person to person, ha? Or either person to person's body fluids fluids and all. So we have there your lesions, general ill feeling, sore throat, and of course, infected material is your broken skin and mucous membrane. Makatakod siya. And another thing, sa panang kuan, COVID, diba? COVID is direct contact, airborne pa jud. And direct contact, airborne, diba? So, direct contact. Di ba mananapat na yung social distancing para ang iyang laway dili ma-transfer sa MUA nga nag-carry og COVID. So, direct contact siya. Again, body fluids. And meningitis. Meningitis, so is an inflammation of the brain or spinal cord that caused by a viral or bacterial infection. If it is viral, so that is your usually respiratory illness, sore throat, nausea, and your vomiting. So it is transmitted through airborne, sa hangin, direct contact, person to person, or indirect contact, or using client's belongings. Food and water and mucous membrane. Anyway, we'll discuss the other types or modes of transmission. Tuberculosis is a respiratory disease caused by a bacteria. So this is now your airborne. Airborne siya. Meaning, ang laway nga nay tubercle bacilli adto sa hangin and then moadto siya actually tugpa sa yuta di ay kay gilwa man. And then after that, mainitan, mauga. Pag mauga siya, ang bacteria musaka sa langit, no? Musaka sa langit. Musaka siya dayon ma-inhale sa individual with poor immune system, and that is now your tuberculosis. Oh, poor immune system siya. Okay. Then saliva and then airborne and droplet infection or droplet nuclei kay ang saliva ma-shower siya sa saliva, the sputum, Then next is hepatitis, is a viral infection of the liver. So we have either your signs and symptoms, you have fluke and jaundice. And direct or indirect contact. So direct kung man siya? Skin to skin. Diba? Okay. Or sexual activity. That is your hepatitis B and C. Then pwede po blood transfusion. That is indirect contact. Hepatitis A. B gihapon. Pwede po siya A pag food and water. Blood and saliva plus seminal fluid, that is your B. Okay. And HIV, human immunodeficiency virus, is the virus that destroys the body's ability to fight infection. The resultant state is referred to as AIDS, acquired immune deficiency syndrome. So, you have the disease HIV. You have the infection HIV by what are the signs? The lower immune system. So meaning human immune deficiency virus ang tapot nimo kay ngano tapton ka sa ubang sakit. O kung matapton niya ka doble triple nga sakit, possibly you have HIV. Pag of course, mudaghan na gali ang mga sakit ni mo ning tapod, dili lang na siya HIV, kundi AIDS victim na ka. So, acquired immunodeficiency syndrome. Ning deficient ang imong immune system because you have HIV virus. So, these are the following signs. So, it could be direct also and indirect through blood transfusion. Okay, direct kung vaginal fluids and seminal fluids or semen or sa lalaki. And next now, we have your indirect contact. So, manata direct no. Pero nag-una-una to sa kwan. So, direct contact occurs when a person touches objects that have been contaminated by the blood or another body fluids of the infected person. O kung nanghikamra ka, including soil dressings, equipment, and vehicle surfaces with which an infected person comes in contact. So, that's siya indirect, di ba? Kanang nagamit ka sa mga gamit sa client nga naisakit. Indirect contact na siya. And then next is your airborne. Occurs when a person inhales infected droplets that have become airborne as an infected person's cough or sneeze, just like COVID, di ba? And tuberculosis. Okay. Airborne po siya. Direct airborne. And then we have your kay cough or sneezes ba. And then next we have your vector. Vector is vector, V-E-C-T-O-R. So occurs when an animal such as dog or an insect such as tick transmit a pathogen into the body through a bite. Napaakan ka. Sample, napakan ka lamok. Vector. So nagmalaria ka. Diba? Dengue fever, that is vector. And then number 2, diseases that cause concern. So, one is as a first aider, you should be familiar with diseases that can have severe consequences if transmitted. This includes herpes, meningitis, tuberculosis, hepatitis B, HIV, and virus that causes your AIDS. That is why di special sila og kanang table dira sa inyong handouts because they are considered as diseases that cause concern. And then next, we have now your BSI. BSI, ang sibot pasabot, body substance isolation. Body substance isolation. 1. Precautions are taken to isolate or prevent risk of exposure from any other type of bodily substances. So, unsa man na siya? Your gloves, diba? So, we have your PPEs. Okay. PPEs or protective equipment, diba? Personal protective equipment, I mean. Okay. So, these are, regardless of the type of exposure risk, you must follow basic precautions and safe practices. Each time you prepare to provide care. Basic precautions and practices are as follows. Unsa sila? One is we have your personal hygiene. So, maintaining good personal hygiene habits such as frequent hand washing and proper grooming are 2 important ways to prevent disease transmission regardless of any personal protective equipment you might use. So, dapat sa COVID, you do hand washing. Okay. Hand washing. And sa inyo proper grooming also additional, And next is protective equipment. It includes all equipment and supplies that prevent you from making direct contact with infected materials. What are those? Disposable gloves, gowns, masks, shields, protective eyewear, or we have in ourselves, we have that one as face shield, diba? And resuscitation devices. Dapat naagi space between the mouth and the patient and your mouth. And then we have equipment cleaning and disinfecting. It is important to clean and disinfect equipment to prevent infections. Handle all contaminated equipment, supplies, or other materials with the utmost care until they are properly cleaned and disinfected. Okay. So, taas dyan siya. No? So, before we're going to proceed with our we're going to proceed with other discussion. We will just have a little background on the human body because it is related. Dapat makabalumugog ka kung sa mga positions. Manang dapat you have to listen, listen. So, human body, the body systems have unique structures and functions, and understanding the human body will be a guide in providing proper emergency care. So, we have there the anatomical terms. So, good for those na humanaw basic disabled and the human body pod. Kay abdik na kay mga pangga. Pero, katunguban, anyways, welcome to IHL. But, of course, our goal here is for you to learn and become an effective and competent caregivers. So, just hold on tight and we will travel. Okay. So, anatomical terms, hato siya. So, important to describe patients' positions, direction, and location to other medical personnel. Using correct terms will allow you to communicate the extent of patient's injury quickly and accurately. Terms of position including your anatomical position, and then we have your supine, and then anatomical position, supine position, anatomical position, kung example, sa lawas, sa inferior or superior, okay, we're going to discuss that more fully. And then supine position, say supine. Supine means hayang. So the patient is lying on his back. Okay. And then prone position, meaning kulob. The patient is lying on his abdomen or on his chest. And then we have also lateral recumbent position. Lateral meaning kilid, or another term for this is we have there side lying, di ba? Side lying, or we have seams lateral position. Pag seams lateral position, the patient should lie on his left side. Okay. Especially during, okay, this is used for insertion of suppositories man. So, magtakilid. Okay. So, lying on his left side. First. And in terms of directions and locations, so we have there your, first you follow ha with the pointer. First means toward or close to the head. That is your superior. Okay. Superior means toward or close to the head. And the opposite of superior, we have inferior, means toward or closer to the foot or feet. Okay, dali na. Superior, inferior. And then next is your anterior, is toward the front. So, pag front part sa body, anterior. Pag back part sa body, posterior. And then we have also, next is medial. Medial means toward the midline or center of the body. So, for example, ang ato ang sa example sa tasakuan ha, superior. Superior means ang atong neck is superior sa atong chest. Diba? Another, we have our knee is inferior to the hips. Diba? Inferior sa ubos, sa hips. Oh, do you follow? Kaning anterior, we have our lips is pressed. Our lips is located anteriorly, diba? Anterior. While our buttocks or butt is located posteriorly. Okay, that is your anterior, posterior, ha? And then we have there the medial. Medial means toward the midline. So, let's say, toward the midline. So, medial siya. So, example, padulong sa midline, ha? Example sa midline, we have your sternum. Midline siya. Okay. Okay. So, that is your medial. For example, sa tawag ini? Kanang episiotomy. Episiotomy means kanang gisi sa pagpanganak. Gigisi og tuyo para makagawas ang baby. So, ang imo ang gisi ana is medial, since syempre, medio or medial lateral. Medial means middle. So, straight ang gisi. So, gikan sa opening, vaginal opening, straight pa dong sa imong lubot, pero dili siya idiretso sa lubot, kundi lateral, ipakilid siya. Nga naman, para dili magisi si lubot. That's your medial. Okay. And then next is now your lateral. Refers to the left or right of the midline. Okay, kani. Left or right? Oh, medial. Oh, is the lateral. Sa palayo or kilid. And next is proximal. Means close or near to the point of reference. While your distal means kung proximal duol. Distal is distant, means layo, from the point of reference. Example, proximo-distal. So, for example, pag may proximal, ang atong base sa proximal isang midline. So, ang atong stroke in doing the sponge bathing is distal to proximal man. Gikan sa imong forearm, padulong sa imong armpit. That is your distal, kay layo man si forearm sa chest. Then, proximal, kay duol man si armpit sa chest. Proximal. Okay, distal to proximal. Kung proximo-distal, gikan sa imong leg, ang samad, asa siya? We have proximo-distal to, unsa man siya? Proximo-distal ang imong leg nga na-injured. Proximo-distal to the, foot. Okay. So, ang samad ni mo pataas padulong sa ubos. Okay. And then next is, layo siya sa body. Layo siya sa center. Manang proximo-distal. Okay, from the word proximal. And then next is your superficial. Superficial is near the surface. Ha? So, skin deep. Okay. Or kanang superficial kanang imong gi-burn. Kanang magamit ka og sana pure skin. Kanang skin chuchu. Kanang mga skin ba? Oh, sana perfect skin. Oh, mana siya superficial ni mga gi-burn ang imong skin. So, it's near the surface. So, ibabaw. Well, deep is remote or far from the surface. Or lalom. That is your deep. And internal, kung sulod sa lawas. External, kung outside. Example, kanang mga haplas. Use, daibutan nito, use externally. So, bawal siya suyupon, ha? External biya use. O internal, sulod. So, we have there your anatomical position in this directional terms here. Nara akong gisuganina. And supine, hayang, prone, kulob, right lateral recumbent position, and left lateral recumbent position. Or you may have this one as seams lateral right and seams lateral left. Okay. Kung left, gusto ka malibang, so you have seams lateral left. O, libang ka in the morning, matulog ka at your seams lateral left para makalibang ka automatic. Okay. And is we have there your body cavity. Here, body cavity is a hollow place in the body that contains organs such as the heart, lungs, and liver, the 5 major cavities. We have there your answer ng 5 major cavities. One is your spinal cavity. This is, look, amin ang spinal cavity. I know, not spinal. Sayop ko, excuse me. We have the cranial cavity. It is located in the head. Kanang gisudlan sa imong utok. That is your cranial cavity. It contains the brain and protected by the skull. And then next is your cavity means na ay case ba? Case, sudlanan. And the next is your spinal. The extending from the bottom of the skull to the lower back. It contains the spinal cord and is protected by the bones of the spine. That is your spinal cavity. O ganang gisudlan sa imong spinal cord. And the next is thoracic cavity, also called chest cavity. Located in the trunk between the diaphragm or diaphragm, which is a dome-shaped muscle used in breathing, and the neck. It contains the heart, the lungs, and other important structures. The rib cage and the upper portion of the spine protected by the thoracic cavity. Okay. Sige, the thoracic cavity, the heart and the lungs, gid ang major niya nga gi-protect. And the next, we have your abdominal cavity. Also, you protect the intestine, the stomach, and the liver. Okay, di ba dali ni memorize and good. Located in the trunk between the diaphragm and the pelvis. Excuse. It contains many organs such as the liver, pancreas, intestine, stomach, kidneys, and your spleen. Because the abdominal cavity is not protected by any bones, okay, the organ is more vulnerable to injury. Manang bawal hiluto ng tiyan, ha? Kay, di ba, i-massage ang tiyan? No, you should not do massage. You should not do any massage to the stomach. Why? Because wala siya bones nga ga-protect niya. Okay, and then we have also the pelvic cavity located in the pelvis, the lowest part of the trunk, and it contains the bladder, urinary bladder, the rectum, and the reproductive organs. It is protected by the pelvic bones and the lower portion of the spine. Okay, happy to tamahuman. So, number 26. These are the main cavities in the picture. Okay, the cranial cavity, spinal cavity, and then thoracic cavity, and then we have your diaphragm or the dome shape, and then we have the abdominal abdominal cavity, and then the pelvic cavity. We will proceed. Asa na ta? Now, we have the body system. The body system knowing how the respiratory, circulatory, and nervous system normally functions will help you understand what happens when system fails. We were going to discuss this shortly. And when body system fails, physical signs and symptoms appear. These are often your first indication that something is wrong, especially if we talk about providing life support. Okay, so the respiratory system, the body may get enough nutrition from food to last for several weeks. The eye, it can store water to last for several days, but it can only store oxygen for a few minutes. That is why our lungs needs oxygen. The body depends on a constant supply of oxygen from our lungs. The respiratory system delivers oxygen to the body as well as remove carbon dioxide from the body. So there's the gas exchange takes place in your respiratory system. Remember. So the passage of air into and out of the lungs is called respiration. Okay, here respiration. Breathing in is called inspiration or inhalation. Okay. While your breathing out is called expiration or exhalation. Okay. So, dali atimanan. Respiration, inhalation, expiration, exhalation. Okay, respiration, inhalation, inspiration, di ba? So, excuse. Okay, during inspiration, the muscles of the thorax contracts, moving the air outward, not the air, the ribs outward and up. The diaphragm contracts and lowers. This movement expands the chest cavity and causes air to flow into the lungs. So, diba? Pag magiging ka, sumansang imong kuan, ang imong ribs move outward. Manang ang imong diaphragm mo contract siya and then mo lower siya. So, kung mo lower ang diaphragm, mo expand si chest cavity. Kung mo expand si chest cavity, so mo flow ang air into the lungs. During exhalation, the opposite happens. The muscles of the chest relax and cause the ribs to move inward. The diaphragm relaxes and moves up. Okay, this is your inspiration or inspiration proper. And next we have now the respiratory system consists of the organs that let us breathe, di ba? Magunsa siya, organs that let us breathe. When air enters the body, it does excuse it does so through the mouth, diba? Gikan siya sa mouth and then the nose. Okay, the mouth and the nose. The area posterior to the mouth and nose is called the pharynx, which is divided into pharynx and nasopharynx. Okay, you follow? Air then travels down those, no, through the wind, through the voice box, or what we call as your larynx, and into the windpipe, which is your trachea. Okay. Gikan siya sa imo ang tag ini, di man sa imong pharynx, ang mouth and nose, and then the pharynx here, larynx is the voice box, and then the trachea as the windpipe. Okay. Then the trachea is the air passageway to the lungs. It is made of cartilage, rings, and is visible in the anterior portion of the neck. Kung makita niyo yung trachea, di ba kanang magburot? Then next we have the epiglottis is the leaf-shaped structure that prevents foreign object from entering the trachea during swallowing. So, ang sige prevent sa trachea from from object that we're going to enter, it is the epiglottis. Then we have also the trachea splits into two bronchi, diba? The trachea splits into two bronchi. So this air passages gradually become smaller and smaller until they reach the alveoli, where carbon dioxide and oxygen exchange with your blood. Okay. So, do you have any questions? Of course, you can have questions. You just listen to the discussion and follow because you already have your handouts. Anyways, life is easy as a caregiver if you will just listen and try to internalize. Okay. Okay, next, it is important to remember that respiratory structures of an infant and children differ from those of an adult. Nga naman, while the structures all have the same names, they may be smaller or less developed in infants and children. These differences are very important. Nga naman, syempre, dili ka pwede, for example, maghatag kag ventilation sa infants, apilo ni mang ilong, dili lang mouth. Okay. All structures, including the mouth and nose, are smaller in children. Manang dapat imong apilon ang nose. They are more easily obstructed by even small objects, blood or swelling. That is why pay extra attention to the infant or child to be sure that airway system or airway stays open. The tongue of the infant also or the child takes up a proportionally more spaces in the pharynx than the tongue of the adult. As a result, it can block the airway more easily. Nga naman, dili siya proportion. Wala pwede siya makablock easily. The trachea of an infant or child is narrower, softer and more flexible. So, tipping the head too far back or allowing the head to fall forward can close the trachea. So, that's why, kung saan baby, neutral plus position. Di mo kaya i-head tilt, ha? Oh, neutral lang. Muhangad normally, nakahangad ang baby. Just hold the forehead or the brachial pulse and then secure the forehead. Whenever needed, place a folded towel or similar items under the shoulders to keep the airway aligned and open. The primary cause of cardiac arrest in infants and children is an uncorrected respiratory problem. Because the chest wall is softer, infants and children tend to rely more heavily on the diaphragm for breathing. So watch for the excessive movement of diaphragm. It can alert you to respiratory distress. Okay, excuse. When you're going to check for the respirations of the infant, so the most visible is the abdomen. Check the abdomen. So we're going to continue okay, so remember that your cardiac arrest, is caused by your uncorrected respiratory problems in infants. Because of, sa siya, we have the softer chest wall, plus, of course, your, you're going to, when you're going to take the respiration, you have to take note the abdomen, not the chest, And then another thing, watch for excessive movement of the diaphragm. Bakit? It can alert you to a respiratory distress in an infant or a child. Okay. So, the respiratory system consists of all the structures of the body that contribute to the process of what we call breathing. So the respiratory system of a child is proportionally smaller and less rigid than that of an adult. So tingnan niyo po yung you're going to observe the structure of the respiratory system of an adult and a child. So built na po yung sa adult. While the child, aside from it is smaller, it is also what we call as your softer. Okay, now we're going to proceed with your circulatory system. We need to discuss this topics because this is very much related to your basic life support. So when you're going to do compression, you're going to stimulate the heart, and that is now your circulatory system. Okay. The circulatory system delivers what it delivers. It delivers oxygen and nutrients to the body's tissue and removes waste products. So as we have learned last week from our previous discussion, it is your vital signs. So the circulatory or the heart will going to ask for oxygen from the lungs. It will going to ask oxygen from the lungs, and then from the lungs, if the lungs now make a response to the heart by giving oxygen, so there will be now oxygen carrying nutrients from the heart that would be delivered to the rest part of the system or the body. So, it consists of the heart, blood vessels, and of course the blood. Now, we have the heart is a hollow muscular organ that is responsible for pumping blood through the body. So, the adult heart contracts between 60 to 80 times, or in some book we have 100 times per minute. Okay, when at rest, and faster when under stress. Okay. Pag at rest po, if the heart is at rest, so normal niyang beating, we have 60 to 100. 60 to 80 and up to 100, I mean. So the adult heart contracts between 60 to 100 times per minute when at rest and faster when under stress. Problems with the heart account for many of the emergencies you will encounter as a first aider. So usually, pag kailangan i-CPR, so there is no pulse already. So basically, pag walang pulse, then you need CPR or cardiopulmonary resuscitation. That is why most emergencies accounts heart problems. The heart is divided into 4 chambers, just like what I have said to you last week. The upper chamber are called atria, while the atria kasi dalawa. Pag isa lang, atrium. And the lower chambers are called ventricles. The heart has a left and right side, each of which has an atrium and a ventricle. and a ventricle. The right side of the heart receives blood from the body and pumps it to the lungs. So basically, if you're going to think of it, the right side of the heart will going to receive unoxygenated blood or your carbon dioxide. The left side of the heart receives oxygenated blood from the lungs and pump it to the body. Okay, remember those, ha? Then we're going to continue. When the heart pumps blood from the left ventricle, that is the left ventricle, blood enters the arteries. This pumping action causes now what we call as wave of pressure that can be felt as a pulse. So this one now is pulse kasi wave of pressure that can be felt as pulse when the blood enters your artery, and then automatic pumping action will then follow. There are many points where pulse can be felt in the body. Okay, the most common are, so I already asked some students to identify this one. We have the carotid pulse, which is felt on either side of the neck, while the brachial pulse we have felt on the inside of the arm between the elbow and then the shoulder. Another, we have the radial pulse point, which is felt on the thumb side of the wrist, while your femoral pulse point is felt in the area of the groin in the crease between the abdomen and then the thigh. Okay. And then the thigh. The blood vessels are closed systems of tube. Actually, we have other pulse sites, ha? Hindi lang po dyan. Yung, ano pa? We have your popliteal, you have your, what you call, temporal. We also have your, dorsalis pedis and posterior tibial. So we have 9 pulse sites. So next, we have the blood vessels are closed system of tubes through which the blood flows. Arteries and arterioles take blood away from the heart. So the first is arteries and then the arterioles. Arterioles means there are capillaries already or small arteries. Okay. The capillaries are ano ba 'to? Hindi. Mali. Teka. Basahin ko. I will going to read again. Closed tube through which blood flows. This is the arteries and arterioles. Take blood away from the heart. Okay. The capillaries are distributors. They are the smallest vessels through which the exchange of fluid. This one is capillaries, ha? Are considered distributors. Fluid, oxygen, and carbon dioxide takes place between blood and tissues. Okay, tissue cells. While your the venules are and veins are the collectors. They carry blood back to the heart from the rest of the body. Okay. So, anong klaseng blood ang nasa loob ng vein? It is unoxygenated blood. What type of blood yung nasa loob ng arteries? It is oxygenated blood. Okay. Now, we will proceed with your breathing and circulation. So, we'll start with number 1. Air that enters the lungs contain about 21% of oxygen. When you will be asked how much oxygen how much air will it enters the lungs? We have 21%. and only a trace of carbon dioxide. Air that is exhaled from the lungs contain 16% oxygen and 4% carbon dioxide. So when you're going to inhale, it is 21% of oxygen. While if you're going to exhale, 16% of oxygen plus 4% carbon dioxide. Okay, ha? The right side of the heart pumps blood to the lungs, where blood picks up oxygen and release carbon dioxide. Again, the right side of the heart pumps blood to the lungs, diba? Where blood picks up oxygen and then release carbon dioxide. Kasi, diba, pag pumunta po when the blood vessel, your vein, will from the system, through the vein, then to the heart, then to the lungs to ask for oxygen. So there will be a blood exchange. Kasi yung kine-carry po ng blood vessel that time patong right side of the heart or right ventricle in particular is unoxygenated blood. So it will going to ask for oxygen. Okay, next is the oxygenated blood then returns to the lungs. Not to the lungs, but to the left side of the heart, where it is pumped to the rest of the body or the tissues of the body. Okay, so in the body tissues, blood releases oxygen and takes up carbon dioxide. So after which it flows back to the right side of the heart, then to the lungs to ask for oxygen. So cycle lang po yun, 'di ba? From the lungs to via your left side of the heart to particularly through a big hose called atrium. Aorta, and then to the rest part of the body. Tapos, finifeed na yung mga cells ng body. After which, kinain na nila lahat yung oxygen, babalik si blood through now your vein, not your arteries anymore, kasi papunta lang yung arteries. Through your vein, and then back to the right ventricle, to the lungs to ask for oxygen. Okay, so remember So, all body tissues require oxygen, but the brain requires more than any other tissues. Okay, remember kung nag-require man yung other tissues natin, mas lalo si brain. So, when breathing and circulation stop, this is called clinical death. That is 0 to 4 minutes brain damage, not likely 4 to 6 minutes damage probable. Okay. 0 to 4 minutes clinical death na po yun. When the brain has been deprived of oxygenated blood for a period of 6 minutes or more, there will be brain damage probably occur. This is called now biological death. 6 to 10 minutes brain damage probable, over 10 minutes brain damage is certain. It is obvious from the above stated facts that both respiration and circulations are required to maintain what we call your life. Life po ang dapat i-maintain natin. So we have clinical death is a condition in which the heart and breathing stop. So without resuscitation, clinical death will result now to your biological death, which is irreversible death of brain cells. Pag sinabi na po, pag clinical death po, pwede nating CPR. Pag biological death, useless na po. So remember, time is very much critical. 0 to 1 minute, there is cardiac irritability. While 0 to 4 minutes, there is brain damage not likely. So clinical death po siya. While 4 to 6 minutes, brain damage possible. So pag 6 to 10 minutes na po, brain damage very likely. Pag more than 10 minutes, irreversible brain damage na. So, dapat you're going to do it fast. Dapat mabilisan. But not in the sense naman na masasuffocate yung masobraan ng oxygen yung client. Hindi na makahinga naman. So, there should be a proper counting. That is why 1,000 is it means 1 second. Okay. Life support, basic life support is a series of emergency which is considered life-saving procedures that are carried out to prolong the life of a victim with life-threatening emergencies. We have 3 kinds, your basic life support or your BLS, which is an emergency procedure that consists of recognizing recognizing respiratory cardiac arrest or both, and the proper application of CPR or cardiopulmonary resuscitation to maintain life until a victim recovers or advanced life support is available. So we have basic ABC steps now. As what I've said kanina, dili na siya ABC kung dili circulation, then breathing, then airway na. Circulation restored, breathing restored, and airway restored. Use of supplementary techniques. So, that is your BLS, ha? And then we have your number 2, we have advanced cardiac life support or ACLS, which the use of special equipment to maintain breathing and circulation for the victim of a cardiac emergency. Usually this occurs in the hospital. While your prolonged life support for post-resuscitative and long-term resuscitation. Pag, for example, nag-coma na po, so prolonged life support na po siya. Chain of survival. We have cardiac arrest depends on the series of critical interventions. If one of these critical actions is neglected or delayed, survival is unlikely. So the chain has 4 interdependent links: early access, early cardiopulmonary resuscitation, early defibrillation, and early advanced cardiac life support. So we have, usually pag defibrillation na you're going to use the AED na siya. So here are your precautions too. So remember early access. So dapat may phone magamit. And then early CPR. Dapat alam mag-CPR. Early defibrillate. So kailangan para bang AED nga. And then early advanced CLS. Okay. Now, precautions to prevent disease transmission. We have now the risk of getting a disease while giving first aid or CPR is extremely low. Bakit? We have there what we called as, bakit low? Bakit low? Because we have practicing body substance isolation or your BSI techniques reduces the risk even further. So, konti lang po yung talaga risk. Kasi remember, we have when you're going to stop CPR. O, di ba? Pag the scene is unsafe, okay, blood is coming out from the patient's mouth. So, you have to stop. So, low talaga ang risk. So, we have here your body substance isolation. We have discussed that one after, a while ago. Di na natin uulitin ha, kasi tapos na. We have there your personal hygiene. Another, we have also your BSI, personal hygiene, personal protective equipment, and equipment cleaning and disinfecting. So we're done with that already. Now we have your cardiovascular diseases. Risk factors we have that cannot be changed, meaning non-modifiable. So, ano po mga risk factor nito? Heredity or genetics? Ano nila? It is running through your genes or blood. So, non-modifiable, we have age. Okay, age. Pag age din, we have there your elderlies. And we have gender. Anong gender? Sino bang mas at risk ng heart attack? There are more more males than female. Next, letter B, risk factors that can be changed or what we call modifiable. So, cigarette smoking, pwede mag-stop ng cigarette, di ba? Smoking. Hypertension, so hindi ka kakain ng matataba or low cholesterol dapat ang diet mo. Tapos, bawal ma-stress. So, elevated cholesterol and triglycerides. So, pareho sila. Lack of exercise, of course. Obesity, stress, and of course, your diabetes mellitus. Bakit diabetes mellitus? Kasi pag diabetes mellitus, your blood daw will become viscous or malapot siya. And then, syempre, pag malapot yung blood, yung heart mo ay mag-e-effort na mag-pump it out to the lungs and to the system. Okay. So, slow din po yung flow pag malapot, di ba? Next is your heart attack or your myocardial infarction. It occurs when the oxygen supply to the heart muscle or your myocardium is cut off for a prolonged period of time. This cut-off results from the reduced blood supply due to severe narrowing of the or complete blockage of the diseased artery. The result is now death, or what we called infarction of the affected part of the heart. Because myo means muscle death ito. So, myocardial na muscle of the heart, then infarction means death. Okay. Warning signals. We have chest discomfort characterized by uncomfortable pressure, squeezing, fullness or tightness, aching, crushing, constricting, oppressive, or heavy chest. So, this po, yung mga points natin, no? Yan po yung mga pain. We have there, dito po sa chest center. At the shoulder pain and even sa stomach. Heart attack is most often felt at the center of the chest, behind the sternum. It may spread to the shoulders, arm, neck, and jaw. Okay, remember this one ha, points kung saan masakit. So those are the warning signals. And then we have sweating, gipaningot, nausea, kasukaon, and then shortness of breathing in case of your right side heart failure. We have first aid management. Recognize the signals of heart attack and take action. So, how? So, dapat mag-blood pressure taking ka, tapos you allow the patient to rest or to sit down. And if there is cardiac drugs on hand or emergency drugs, you give the drug. Have patient stop what he or she is doing and sit or lie her down in a comfortable position, and then do not let him move around. Yes, dapat mag-relax po siya. Have someone call the physician and ambulance for help. If patient is under medical care, assist him or her taking his or prescribed medicine. So, as what I've said, pag siya, may medicine siya sa pocket or sa bag. which is prescribed by the doctor. And we have respiratory arrest. It is the condition in which breathing stops or and is inadequate. In respiratory arrest, the person gets no oxygen. Wala na pong oxygen. The body can function for only few minutes without oxygen before body system begin to fail. However, you can keep the person's respiratory system functioning artificially with rescue breathing. Pwede siya pag mag-rescue breathing ka. Or we have that one as AR. You're going to give 24 ventilation. The cause of respiratory arrest. Ano po yung cause niya? So, we'll proceed with the cause. Either obstruction, disease, and other respiratory causes. We have their obstruction. Pag obstruction naman, either anatomical and mechanical. When you say anatomical, so it includes your tongue. When the tongue drops back and obstruct the throat. Other causes are acute asthma, diphtheria, swelling, and cough. We have especially whooping cough. Yung mga may ubo, that's your anatomical obstruction. It could cause respiratory arrest. And then mechanical obstruction. When there is what we call as foreign object that lodge in the pharynx or airway. This is foreign, Mr. Foreigner, foreign object that lodge in the pharynx or airways. Fluid accumulates in the back of the throat, now causing your obstruction. Now, we have leading to respiratory arrest. Another diseases. We have bronchitis, inflammation of the bronchi, pneumonia, presence of fluids in your lungs, and chronic obstructive pulmonary disease or your COPD and other respiratory illness. What are the COPDs? We have your asthma, we have emphysema, and of course your bronchitis. Excuse me. Number 3, other causes of respiratory arrest. What are they? Electrocution, nakurintihan, circulatory collapse, okay, ni heart, yung undang ang heart ug beat, external strangulation, gituok, chest compression, or giduot, naduot siya dito, nalagpot siya dito ning banda sa wall. Okay. By physical force or gisumbag bakaha. Drowning, nagilumsan. Poisoning, gihiluan. Plus suffocation. Suffocation, na siya sa burning or fire, diba? Or area. Or tasking fume ang area. Or suffocation ka na naka sa gasoline station. There's also suffocation ka nang mamubok ka o moyatik sa CR din sirado or bisan og what we call this one zonrox. Okay, so next is your rescue breathing. This is a technique of breathing air into a person to supply him or her with the needed oxygen to survive. Rescue breathing is given to victims who are not breathing or inadequate but still have pulse. So this one, negative breathing, positive pulse. Okay. So ways to ventilate the lungs. We have there your mouth-to-mouth rescue breathing is a quick, effective way to provide oxygen and ventilation to the victim. Your exhaled breath contains enough oxygen to supply the victim's need. To provide, to provide rescue breaths, hold the victim's airway open, and then pinch the nose. Make a seal with the mouth over the victim's mouth. And then we have now over the victim's mouth. Then rest the palm on one hand on the victim's forehead. Okay. Diba? And pinch the victim's nose. Then we have there as your pinch and then make a seal with your mouth over the victim's mouth and rest the palm on the one hand on the victim's forehead and pinch the victim's nose. Close with your thumb and index finger, ha? So, seal mo siya using your thumb and index finger. Pinching, excuse me. Pinching the nose will prevent air from escaping through the victim's nose. Take a deep breath and seal your lips around the victim's mouth, creating an airtight seal. Okay, hilagpot na ko sa number 2 pamangko, napindutan na ako siya. Napindutan. Okay. So, di na lang. Ako na lang ibasa to. Anyway, you have your handouts. Number 2 is mouth-to-nose breathing. Pag mouth-to-nose breathing is a method of ventilation which is recommended when it is impossible to ventilate through the victim's mouth. The mouth cannot be opened, the mouth is seriously injured, or a tight mouth-to-mouth seal is difficult to achieve. To provide mouth-to-nose breathing, tilt the victim's head back and with one hand on the forehead and use the other hand to lift the victim's mandible, as in head tilt, chin lift, and close the victim's mouth. Take a deep breath and seal your lips around the victim's nose and exhale into the victim's nose. Then remove your lips from the victim's nose, allowing passive exhalation. It may be necessary to open the victim's mouth intermittently and separate the lips with the thumb to allow free exhalation. This is particularly important if partial nasal obstruction is present. Okay. So, that is your mouth-to-nose breathing. Tapos ng mouth-nose naman. Now, we have your mouth-to-mouth and nose, which is applicable to your below 1 year old. Or if the victim, that is your mouth-to-mouth and nose. If the victim is an infant, place your mouth over the infant's mouth and nose to create a seal. Blow into the infant nose and mouth, pausing to inhale between breaths, attempting to make the chest rise with each breath. Then we have a variety of techniques can be used to provide rescue breathing for infants. A rescuer with a small mouth may have difficulty covering both the mouth or the nose and then the open mouth of a large infant. Under this condition, mouth-to-nose ventilation may be adequate. There is no convincing data to justify a change from a recommendation that the rescuer attempt mouth-to-mouth and nose ventilation to infant up to 1 year old. During rescue breathing attempts, you must maintain good head position for the infant. So that is your head tilt, chin lift to maintain patent airway and create an airtight seal over the airway. Okay, that is your mouth-to-mouth and nose. And then the number 4, we have mouth to stomach. Pag hindi po pwede yung mouth and nose, with mouth to stomach. For example, yan po yung may nakatrach po yung patient. That's your mouth to stomach, ha? So, a tracheal stoma is a permanent opening on front of the neck and extends from the surface of the skin into the trachea. When a person with a tracheostomy requires rescue breathing, direct mouth to stoma, mouth sa caregiver to stoma, or ventilation should be performed. Place your mouth over the stoma, making an airtight seal around the stoma. Blow into the stoma until the chest rises. Then remove your mouth from the patient, allowing passive exhalation. Last one is mouth-to-face shield rescue breathing. Okay. Mouth-to-face shield rescue breathing ang last one. Unlike mouth-to-mouth device, face shields have only a clear plastic or silicone sheets that separate the rescuer from the victim. The opening of the face shield is placed over the victim's mouth over the tongue. Then pinch the victim's nose closely and seal your mouth around the center opening of the face shield while maintaining head tilt, chin lift, or jaw thrust maneuver. Provide slow breaths, 2 seconds each, through the way valve or filter in the center of the face shield, allowing the victim's exhaled air to escape between the shield and the victim's face when you lift your mouth off the shield between breaths. Okay. So, no need to do it further. Usually, ano siya, face shield. Pwede mo yung bag mask yung gamit mo. Number 6, mouth to mask, rescue breathing. We will not deal with it anymore. Kasi, and then bag mask. Bag mask ang number 7. Bag mask po yan. I won't be reading those things na anymore because you have it in your handouts, but we will not apply it. Kasi yung nag-apply ng bag mask at yung iba are mga health practitioners na po. So, usually sa atin, CPR, mouth to mouth and nose. Okay, do you have any questions before we're going to proceed further? Pabalik-balik po ang discussion para ma-memorize ha. Anyways, we will going to deal with it on your demonstration. So, I will going to have demonstration tomorrow for you to follow. Techniques of rescue breathing. The following are the procedures in providing rescue breathing for adult, child, and infant suspected of respiratory arrest, either performed by a certified healthcare provider or a lay rescuer or a caregiver. We have skill 3-1, rescue breathing for adult victim. Ay, summarize ko na lang. Pareho lang naman ang rescue breathing ng adult except for the counting. Okay. So, step 1, yung step 1, tsaka hanggang step 4 ata, pareho lang. So, check the scene for safety, then check consciousness of the victim. And then, if the victim is found unconscious, try to confirm by checking his or her responsiveness by gently tapping him or her and asking, "Are you okay? Hey sir, are you okay?" Okay. Then, next is step 3. If the victim does not respond, roll the victim onto the back. So, dapat nakasupine position siya while supporting the head and neck. Then, after which, position the airway. Tilt the head and lift the chin to open the airway. Look, listen, and feel for the adequate breathing at least 5 seconds. So, LLF po siya. So, tomorrow, I'm going to teach you how. Step 5, if the victim is not breathing adequately, give 1 or 2 rescue breaths. Tilt the head back and lift the chin to open the airway. Pinch the nose shut and take a breath and breathe slowly into the victims until the chest clearly rises. Okay, that is your step 5. In step 6, if breaths go in, check for signs of circulation, such as your pulse, the normal breathing, and coughing or movement in response to rescue breaths from the certified caregiver or healthcare provider. While look for severe bleeding. Okay. So, if you have done already the primary survey, no need of this looking for severe bleeding. Step 7, if the victim has no severe bleeding but it is not breathing adequately, give rescue breathing. Tilt the head back and lift and chin to open the airway. Pinch the nose shut. Take a breath and breathe slowly into the victim's until the chest rises. Continue to give rescue breaths about every 5 seconds. Do this for about 1 minute. So, 10 to 12 breaths. Diba? So, 10 to 12 breaths po. Pero ngayon, 24 breaths na po. Healthcare providers can give rescue breaths in 3 ways. Mouth to mouth or mouth to nose technique. Mouth to barrier device technique, use of face shield or mask, or the bag mask technique. So, as what I've said, we will only concentrate to mouth or mouth to nose. Step 8, we check for the circulation. Check for signs of circulation for no more than 10 seconds. Step 9, if victim is still not breathing adequately, continue rescue breath. Checking for signs of circulation should be done after the first minute of the rescue breathing and every few minutes thereafter. Well, you step 10, if adequate spontaneous breathing is restored and signs of circulation are present, maintain an open airway and place the patient in a recovery position, and that is your side lying position. Okay. So, we have here your rescue breathing for children. So, pareho lang po yung counting ha. So, what is the counting now? In giving rescue breathing, kasi mas nauna yung discussion sa rescue breathing kasi CPR. Yung rescue breathing ha, ang counting niya adult, tsaka yung child. That is your in counting for, ano ba yun? So, we have there you're going to give 24 ventilation. How are you going to do it? Parang ganito. So, ano ko na ha. So, parang blow. So, first you have to seal the mouth, then pinch the nose. So, tilt head, pinch nose, open mouth, and then blow. So, your hand also is holding the forehead of the person, and then you're going to tilt it maximum tilt po, maximum tilting to open the airway. So, anong gagawin? Head, tilt head, pinch nose, open mouth, and then you're going to give blow. And after giving blow, you try to LLF, look, listen, and feel. So, dapat yung cheek po nyo nasa over the mouth of the patient. So, kailangan ma-feel nyo kung nag-breathe pa yung patient. So, ang tawag dyan, LLF. Look, listen, and feel. So, LLF ka po for about, ano ba yun? So, pila ka seconds? 5 seconds. So, 1, 2, 3, 4, 5, and then give another blow. And during the look, listen, and feel, you have to look for the rise and then the fall of the chest. And then you have to feel the air coming from the mouth and nose that will going to touch your cheek. And then feel also the pulse. That is your LLF. And then after that, you're going to look, listen, and feel. Then after, so pag natapos mo na, you give another blow. So, blow na naman. Tilt head, pinch nose, open mouth again. And then after that, you have to repeat it for 24 times. Okay. So, and before you're going to check now your, before you're going to end, pag wala po talagang air, pag 24 times na, you check for circulation. So, back ka naman sa LLF ka na naman, check for circulation, counting 1, 1,002, 1,003, 1,004, 1,005, 1,006, 1,007, 1,008, 1,009, 1,010. And then, of course, there is already breathing, positive pulse, positive breathing. Pag walang breathing again, you repeat the procedure. Okay. Okay, so that is pag adult and child. Pag infant naman, yung kamay mo, wala po siya sa forehead, kundi nasa brachial pulse, which I'm going to show you tomorrow. Okay, tomorrow. And then the counting would be 1, 1,002, 1, 1,003, 1, 1,004. So, 1, 1,002, blow. 1, 1,003, blow. 1, 1,004, blow. Up to 40, ventilation. Remember, you begin with blow and with blow. You begin with giving ventilation and end also with giving ventilation. Okay. Before you're going to check the pulse and the breathing. So, that's it. That is now your rescue breathing. So, again, pag-count natin sa checking ng pulse lang po silang tatlo, adult, child, at infant. Ano po yon? 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. And then you declare either negative pulse, negative breathing. So you're going to perform CPR, or negative pulse, a negative breathing, positive pulse. So you're going to perform artificial respiration, or your AR. Okay. So that's it. So i-skip na lang po yung yung mga pa yung mga ibang sa ibang steps kasi ko na ano ba yun? Pag pala siyang breathing and then circulation, of course, you're going to place the patient to recovery position. Okay. Okay, so I'm counting 1, 1002, 1, 1003, 1, 1004, plus yung pag adult at child, yung shoulder ang i-shrug mo. Pag infant, yung feet lang itatap mo. Yung, yung foot niya po. Yung sole ng foot niya pala. Okay. So, you have to do the giving of your ventilation for about 1 minute. 1 minute kung infant. So, skip na natin yan. Okay. So I have here the table of comparison of rescue breathing for an adult and infant. Anyways, ang counting, how you remember, the rate is 10 to 12 breaths per minute. 1 breath every 4 to 5 seconds. So that is your 24. Now is 24 na siya. 20, yung sa adult. Yung sa infant pala is 40. Tignan nyo, oh. 40. Last time, 20 lang po. Pero ginawang 24. Yung infant, wala. No changes. We have 40 still. 1040. Again, so as what I've said, here, you look at it. So begin with blow and end with blow. Or begin with breath, breathing, and then end with breathing. Okay, that's it, ha? Anong difference lang po na checking the pulse? Pareho pong adult and child, carotid pulse, pero yung brachial, yung infant. At yung yung adult, yung opening the airway, head tilt, chin lift maneuver. So, maximum tilt of the head, ang adult, plus yung child is neutral plus. Ang infant naman, neutral position lang po. Okay. No need to tilt. Okay. Kaya lang, syempre, dami yung gamit natin. So, pag dami yung gamit natin, kailangan natin pasekretong i-tilt. Kasi hindi papasok yung air pag pag di tayo nag-tilt. Okay, so, foreign body obstruction. In cases, if the cause of the no breathing is your foreign body obstruction, we have the cause of obstruction, we have now your improper chewing of your food. So, improper chewing of the food. So, balik-balik yung discussion na hindi ko kasi na-edit. So, causes of obstruction, improper chewing of large pieces of food, yes. Excessive intake of alcohol. The presence of loose upper and lower dentures. Luwag ang dentures, natulon ang martel. And then for children, running while eating is also a sign of is that a sign, a cause of obstruction? And for all smaller children, because of the fact that they were going to pick up the object and put it in the mouth, which is very much prevalent among infants. So that's why hand to mouth sila. So that's why they are prone to have choking. Okay. So we have discussed the types of obstruction. Ano yon? We have anatomical obstruction and mechanical obstruction. We have discussed this one, huh? So we have now your partial classification obstruction. We have partial obstruction with good air exchange. Oh, partial na na-obstruct. So, may hangin pa rin pumasok at lumalabas. The victim is responsive and can cough forcefully. So, what will you do with this? You just teach the patient to cough. Instruct the patient to cough, Although frequently there is wheezing between coughs, as long as good air exchange continues, encourage the victim to continue spontaneous coughing and breathing efforts. At this point, the rescuer should not interfere with the victim's own attempts to expel the foreign body, but should stay with the victim and monitor these attempts. Okay. And next, we have also your partial obstruction with poor. This one is poor air exchange. The victim has weak, ineffective cough, high-pitched noise while inhaling, increased respiratory difficulty, and possibly cyanosis. Nalagom na ang patient. Treat a victim with partial obstruction and poor air exchange as if he had a complete obstruction. What will you do? Complete obstruction ay ma-manage mo. So, dapat either you're going to do Hemlic maneuver or ano pang technique. So, complete or total obstruction, the victim is unable to speak. Again, pag partial obstruction lang, your treatment nyo po ay complete or total obstruction. Ang handling, ha? The victim is unable to speak, breathe, or cough, and may clutch the neck. So, you're going to hold his neck with his thumb and fingers. Movement of air is absent. The public should be encouraged to use the universal distress signal for choking emergencies. What is the universal distress signal? We have yan po. Oh, yan ang universal distress signal. Yang signal na yan. Clutching the throat with one or both hands is a universal recognized as a distress signal for choking. You have to ask the victim where he or she is choking. If the victim nods, hingyango. Ask the victim if he or she can speak. Can you able to speak? If the victim is unable to speak, that indicates that there is complete airway obstruction is present, and you must act immediately by performing Hemlic maneuver. Okay. Pag obstruction ha, Hemlic maneuver. Pwede itap ni mo ang likod. Pwede po ni mo siya Hemlic. Okay. Is recommended for relieving foreign body airway obstruction. The term subdiaphragmatic abdominal thrust or abdominal thrust or what we call to as your Hemlic maneuver. Okay, pareho lang sila. Sinabi dito, the subdiaphragmatic abdominal thrust or Hemlic maneuver. By elevating the diaphragm, a subdiaphragmatic abdominal thrust can force air from the lungs. This may be enough to create an artificial cough and thereby expel foreign body obstruction. It may be necessary to repeat the thrust multiple times to clear the airway. An important consideration is that it has possibility to damage internal organs such as rupture or lacerated abdominal or thoracic viscera during the maneuver. So, dapat di po niyo siya balik-balikon. Usually, 1 or 2 or maximum 3 lang po. Such as your lacerated abdominal or thoracic viscera during the maneuver. To minimize this possibility, the rescuer's hands should never be placed on the xiphoid process. Okay. Saan po yung xiphoid process? No? The end tip of the sternum. Or on the lower margins of the rib cage. They should be below this area but not above the navel and in the midline. May occur as a result of abdominal thrust. Okay, you have techniques. Sana tayo dito. Okay, techniques of foreign body airway obstruction. So check the scene of the victim. Parera, ask the victim if he or she is choking. Identify yourself and ask the victim if you can help. So ano sabihin natin? Can you breathe? Okay. I am Erin Lim, trained first aider. I can help. Okay, if the victim cannot cough, speak, or breathe, have someone else to call 911, and then you do the job, or you do the giving of the abdominal thrust, Hemlic maneuver. Place the thumb side of your fist just above the victim's belly button. Grab your fist with your hand. Give quick upward thrust, just like that. Chuk, chuk, okay. Then step 4, continue giving abdominal thrust until the object is forced out. The victim becomes conscious. Okay, so and we have still 4-2, obstruction management of conscious child victim. Pag child naman, abdominal thrust pa rin. Pareho pa rin, ha? Pero pag infant, iba ng usapan yan. We have now your back blows and then chest thrust. Okay. 5 chest thrust. So, 5 times lang po. I'm going to demonstrate that one tomorrow. Step 4, continue back blows and chest thrust kung bata ha, then force the object out. Special situations. Sa special situations na po tayo. So, if you have any questions ha, pag may walang hindi na-answeran ang yung mga step nyo po, you're going to call my attention. Para ma-answer na to. If you are alone and choking, you can give yourself abdominal thrust by leaning over, ano na to? Tawag ni, firm objects. Dapat firm objects such as the back of the chair and pressing your abdomen into it. Okay, yan po. Pag ikaw po, special situations yan. Ikaw lang mag-isa tapos na-choke ka pa, di ba? So we have, if victim is pregnant or too large for you to give abdominal thrust, give chest thrust. To give chest thrust, grab your fist with your other hand and place the thumb side of the fist on the center of the breastbone and give quick thrust into the chest. Kung pregnant, kung dako ang atong pasyente. Okay. Just like this. O, tingnan mo, yung picture na yan. Okay, so, we're going to proceed now. So, anyways, pareho lang po yung adult tsaka child ha. So, we're going to skip now the child. O, tingnan nyo, unconscious adult na po tayo. So, when the victim becomes unconscious, place him or her in the floor. Sa floor po, pag unconscious ang victim. And then, look for an object. Okay. So, lift the jaw and tongue and look inside the mouth. Open the victim's mouth by grasping now your both the tongue and the lower jaw between the thumb and the fingers and lifting the mandible. If you have seen the object, sweep it out with your finger. Okay, that's it. Then position the airway. Tilt the head and lift the chin to open the airway. Look, listen, and feel for adequate breathing. If the victim is not breathing adequately, give 1 to 2 rescue breaths. If the victim's chest does not rise with the breath, reposition the head and give 1 to 2 more rescue breaths. Okay, so 1, then 2. Perform now your abdominal thrust if the victim's chest does not rise. Okay. So you just, I'm going to demonstrate them on this one, so no need to elaborate pa. I want you to just observe the demonstration. Ha? Okay, para dili pa magkamatay. So, special situation na naman with a noticeable pregnant or conscious victim or any victim whom you cannot effectively deliver abdominal thrust. Give chest thrust, kneel next to the victim. Place the heel of the one hand on the center of the victim's chest. Okay. And give a quick 5 quick thrust. Each thrust should compress the chest 1.5 to 2 inches. After giving 5 chest thrusts, do a finger sweep, open the airway, and give 2 slow breaths as you normally would for unconscious choking victim. Repeat the sequence and the object was not expelled. Okay. So I'm going to demonstrate this one tomorrow again. Okay. So now, we will proceed with your, ano na, sana tayo. Tapos na kaya tayo sa mga object, for an object. Now, we're going to do CPR technique for your cardiopulmonary resuscitation na. So, skip na natin yung ibang slides, ha. We just read na lang this one. Anyways, do not perform finger sweep, ha. Wala kang object na nakita. Okay. Now, okay, so we're going to proceed with your CPR. Hanapin ko muna siya. Okay, here. Your cardiopulmonary resuscitation. So we have there for the victim of cardiac arrest, all the ABCs of CPR are required in rapid succession to optimize the chance of survival. The chest compression technique consists of serial rhythmic applications of pressure over the lower half of the sternum. This compression provides circulation as a result of a generalized increase in the intrathoracic pressure or the recompression of the heart. Blood circulated to the lungs by chest compression will likewise receive enough oxygen by proper performed rescue breathing. The patient must be in the horizontal supine position during the chest compression. Even with properly performed compression, blood flow to the brain is reduced. Whenever the head is elevated above the heart, blood flow to the brain is further reduced or even eliminated. If the victim is on bed or board, preferably the full width of the bed should be placed under the patient's back. Rescue breaths and chest compression must be combined for effective resuscitation of the victim of your cardiopulmonary arrest. Okay, so here, chest compression techniques for adults. Again, pag adult, dalawang kamay. Pag child, isang kamay lang. Pag infant, fingers lang po siya. Okay. So, proper hand placement is established by identifying the lower half of the sternum. The guidelines below may be used on or you may choose alternative techniques to identify the lower sternum, following our guide for health providers. So, you have to place your fingers at the lower margin of the victim's rib cage on the side near you, kung saan ka po na side. Slide your finger up to the rib cage to the notch where the ribs meet the lower sternum in the center of the lower part of the chest. So we have there, so you have to locate the xiphoid process. That is your xiphoid process. Place the heel of one hand on the lower half of the sternum and the other hand on the top of the first, so that the hands are parallel. Be sure the long axis of the heel of your hand is placed on the long axis of the sternum. This will keep the main force of compression on the sternum and decrease the chance of rib fracture. Do not compress over the lower portion of the base of the sternum, which is the xiphoid process. Kaya ma-fracture siya, friend. That is why you have to locate the language is this. You have to locate the xiphoid process with your ring finger, and then add two fingers, the middle on the index, and put the heel of the palm of the next arm, and then get your finger, the hand that locating the xiphoid process, and put it over your hand, and then with the heel of the palm give compression. You have to do 30 compression and 2 ventilation and for 5 cycles. You have to begin with your compression and end with your, what you call this one, ventilation. You have to compression, ventilation, compression, ventilation, compression, ventilation, compression, ventilation. I have baka mag-check pulse and breathing. And you're going to do it for 5 times. 5 times po. I'm going to show you that tomorrow. So, especially the hand placement and all. Oh. Sa bata, yes, yan. Sa heel of the palm, dapat heel of the palm, tingnan nyo. Ito po yung sternum. Push straight down with the weight of your body, then release, allowing the chest to return to the normal position. I'm going to show you again tomorrow. Okay. Okay, adult victim. And then here. Okay. Kasi masyadong mataas po siya. Again, you're going to do it to 30 compression for 5 cycles, ha? And then 2 rescue breathing. For infant naman, and then counting is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, plus then 20. Then 1, 2, 3, 4, 5, 6, 7, 8, 9, and 1. And 9 and 1 while doing the compression. And then compression again. Count, rescue breath pa pala. Dalawa. So, look, listen, and feel. Tilt head, pinch nose, open mouth, then LLF. Dayon, ang counting, ay, walang counting kasi rescue breath lang po. So, 5 seconds interval, then blow again, and then after that, LLF again, then do rescue breathing again, then doing tilt, and then doing compression, locate the xiphoid process, but you're going to do it only once. Once lang po. And then, no, not do it. Say it only once. Locate the xiphoid process with your ring fingers. Add 2 fingers. Put the heel, the palm, then interlock with the other, and then compress. And then you're going to count again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 2. Then give another ventilation, 2 ventilation. Okay, then do it for 5 cycles. Then I have to check pulse and breathing. 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Anyway, pag rescue breathing sa infant, ang rescue sa breathing sa infant is 1, 1002, 1, 1003, 1, 1004. Well, sa adult is 1, 1002, 1003, 2. 1, 1002, 1003, 3. 1,002, 1,003, 4. Okay. Pwede pa 1,001, 1,002, 1,003, 2. 1,001, 1,002, 1,003, 4. Masyado mataas na. Diba? So, pag infant naman, pag CPR, 2 fingers, locate your no. Make imaginary midline pala with your index and then the finger with your nipple as guide, and then locate with your index finger, add 2 fingers, and then of course the 2 fingers will be the one to compress. O pwede din yung iba, yung index tsaka yung middle ang mag-compress. Pero mas pag gusto mo mas middle lang tsaka yung index. Anyway, the depth of compression during CPR. Pag adult, that is 1.5 to 2 inches. Pag infant, pag child, that is your 1 to 1.5 inches. And pag infant, ang depth of compression natin is 1/2 to 1. Okay. Remember those, ha? Okay, so anyways, I'm going to, if you want, you just read your handouts and then ako lang i-summarize tomorrow. So, criteria for not starting CPR. We have the scientific evaluations has shown that there are no clear criteria to predict the futility of CPR accurately. Therefore, it is recommended that all patients in cardiac arrest receive resuscitation unless the patient has a valid, do not attempt to valid DNR. We have there do not attempt resuscitation order. So, nagpirma siya waiver, do not resuscitate. And then, DNR ha, do not resuscitate. But sa una, do not attempt resuscitation. Pareho lang yan. The patient has signs of irreversible death. Hindi na po siya ma-revive. Nag-stiff na po siya. That is your rigor mortis. Okay. Or care of the dead. Rigor mortis, nag-stiff na nga. Decapitation or dependent lividity. No physiological benefits can be expected because the vital functions has deteriorated despite maximal therapy for such condition as progressive septic or cardiogenic shock. So, wala na pong chance mabuhay ang patient. So, pwede na hindi mag-CPR. Withholding attempts to resuscitate in the delivery room is appropriate for newly born infants with confirmed gestation less than 23 weeks. So, hindi na po siya, dapat abot siya ng 37 weeks of gestation para maging premature. Pero pag 23 weeks, wala na po, hindi na po siya mabubuhay kasi below 7 weeks. O 7 months pala. And then we have less than 400 grams yung weight ng baby. And then we have confirmed trisomy 13 or 18. So there is abnormality sa baby. Kulang ng parts yung body niya. When to stop CPR, stop there is spontaneous breathing. Spontaneous sign of circulation, spontaneous breathing are restored, and then turn over to medical services or properly trained on authorized personnel. And then O, operator is exhausted. And then P, physician assumes responsibility, or we have he already declares the patient as dead. And then the last S here is the scene is unsafe. Do not forget the last S, ha? The scene is unsafe. Here is this kanong akong gistorya ganina. Just read this one and you have your handouts. So now we were going to discuss shock. Shock is a depressed condition of many body functions due to failure of enough blood to circulate throughout the body following serious injury. Basic causes of shock: pump failure. The heart fails to act properly as a pump. And then, so, hindi na po siya nagpa-pump ng blood. And then, next, relative hypovolemia or less blood ang hypo means decrease, volemia means volume. Do the blood vessels dilate? So the blood within them is insufficient. So, malaki yung blood vessel. Yung blood vessel, yung ugat. o your arteries now. So, insufficient po yung, kasi malaki yung blood vessel, tapos insufficient yung blood na dumadaan dito. So, there will be a problem. So, you have to provide efficient perfusion. So, and then we have hypovolemia. Blood and plasma can be lost so that the fluid contained within the vascular system is insufficient to perfuse blood. Cause of shock, we have severe bleeding, crushing injury. No bleeding po ang patient, crushing injury, yung for example, crushing injury, ano ba yun? Yung, murag na, ang tiil, naligsan o pison. O, di ba? So, crushing. So, there is severe bleeding also. Infection, heart attack, perforation na ay, yung perforate, may buto, or ning kuan, ning budlot. Anaphylaxis, shell bomb and bullet wounds, rupture of tubal pregnancy, starvation, and disease may cause shock. So, these are the causes. Factors which contribute to shock. We have price-F, pain, rough handling, improper transfer, continuous bleeding. So, pag mag-shock, there will be low blood pressure. Continuous bleeding, exposure to extreme cold or excessive heat, that's your fatigue. Dangers of shock we have lead to death, predisposes the body to infection, lead to loss of body part. It shows you your signs and symptoms, early stage, face, pale or cyanotic in color, lalagom or luspad. Skin is cold and clammy, so hypovolemia siya. Or karapong gutom kaayo, or hypoglycemia. You would also develop shock. Breathing is irregular, pulse is rapid and weak, and your nausea and vomiting. So, nausea meaning kasukaon, vomiting ning suka na jud. Ang pulse is kusog, pero weak siya. Ang in between. Weakness and then thirsty. Late stage. If the condition deteriorates, victim may become apathetic, murag nga, or relatively unresponsive. Eyes will be sunken and vacant expression. Pupils are dilated. So we have here, diba, signs of shock, dilated pupils. Blood vessels may be congested, producing mottled appearance. So, ang nagkumpol-kumpol ang dugo, maklaro sa kuan. And imong tanawon niya ang kuan kanang skin naglagom-lagom. Blood pressure has very low level, unconsciousness and body temperature falls. Bugnaw ang patient. Objectives of first aid to improve circulation of the blood, to ensure an adequate supply of oxygen, to maintain normal body temperature. These are the objectives. How you have to take note of this. And first aid and preventive management of shock, we have proper position. So you keep the victim lying down flat, elevate the lower part of the body. Also, if injury is severe, from 8 to 12 inches high. Place the victim who is having difficulty in breathing on his back with his head and shoulder raised. Then, if head injury, apply pressure to the injury and keep the victim lying flat. Do not elevate the head or lower extremities if there is shock. When the color of the face returns to normal, elevate the head and shoulder and continue giving care to the injury. In chest injury, raise the head and shoulder slightly. When there are symptoms of nausea and vomiting or unconsciousness, keep the victim lying on one side, preferably opposite from his injury except for sucking, wounds, and stroke. The position is known as recovery or coma or lateral position. Okay. Ito po yun. O, diba? Yan. Pag lower extremity elevated 8 to 12 inches. Then, pag mag-gain na consciousness, head and shoulder raised na naman. And then, recovery position. Yan po ha, yung natin. Diba? So, madali lang naman. So, while doing the position to prevent, in handling shock, you may also apply what we called as your blanket. Okay, for proper body heat. So maintain body temperature and victim must not be neither perspiring nor chilling. Okay, perspiring nor chilling. If the weather is warm, the victim need not to be covered. O, pag igang, ayaw i-cover. If the victim is cold in spite of the weather, a blanket will be placed underneath him and cover the body. Okay. So, we are now done with our first half of this module. And it is called now Emergency Management 1. So, I'm going to deliver with you your demonstration tomorrow. And I'm going to thank you for finishing this video. And if you have a good heart, you please like, subscribe, so that the videos were going to run in YouTube. Anyways, I did it privately, di pwedeng i-public. Pero if you wish, you may share it na lang. Okay, thank you very much for your patient in in reading or listening to the discussion given, and I'm going to post the video soon. Thank you very much. More power to us, IHLCTC. Thank you.